Hi folks, this is Dr. Virender Sodhi. Today I'm going to talk about how often you should use psyllium husk. Psyllium husk is a fiber and it's a water-loving substance. So what it comes in contact with water, it swells up and has many benefits because of that. It's called mucilaginous because it's like a sticky kind of stuff there. It's grown in India. The plant name is Pentago ovata. Ovata means like egg-like, so the seed is kind of little round oval-like, and it's many seeds are grown on one small plant, around 15,000 seeds on a small plant of psyllium husk plant. The name is Pusala, comes from the Greek word which means fleas. You might have seen fleas in your cats and dogs. And if you know how they look like, they're like very small, teeny. So just think about the teeny seeds looking like fleas, and but it's very coated with lots of layers of fiber, mucilaginous fiber. And when you eat it, it comes in contact with the water and it swells up. So has many benefit because of that, because of the fibrousness of it, because of the mucilaginousness of this plant. So one of the wonderful benefit is on the digestive system. It can be helpful for constipation and making you more regular. But we will also talk about some of the side effects because of that. So constipation, you can relieve it and take it. I usually encourage my clients to take around 2 tablespoons of it, not small dose, with water, with lots of water, because it needs moisture to swell up and to become like a mechanical action of going through your intestine. The second benefit that you have is on blood sugar. This is a carbohydrate, but it's not soluble in your body. So when you're not absorbing in your body, it's not going to create an insulin reaction. So it can help diabetic patient, also people who are pre-diabetic, or people who has a sugar cravings, because you can also use that to cut down your sugar craving because of that action. It also can be heart healthy because it helps to lower your cholesterol. How it does it? With the same mechanism, because the fiber, and it binds onto the excessive amount of cholesterol in the intestine, and you poop it out through your intestine. So it can lower your cholesterol. And I think the study shows around 10% lowering of cholesterol, which is pretty darn good. And not creating lots of other side effects which we see with the standard drug treatment. It can be also used for appetite control because it is mucilaginous, it swells up, it slows down your digestive system, and like a moving through, the motility kind of reduces a little bit, so it does not make it very quick. Ayurvedically, we use it for both condition of diarrhea and constipation. And in diarrhea, again, it's mucilaginous, so it's gonna pulp up and slows down the motility. Most of the diarrhea people get is because the motility of the intestine has increased and they're running to the bathroom more. And in case of constipation, the motility is slow, so it's because of the mechanical action. It's going to swell up and create that mechanical action and extracting it out of your system and helping the digestive system. So you can see there's lots of benefit. But what I'm going to also tell you, don't use it regularly. Because the research done in 1987 on chimpanzees, they used psyllium husk for the chimpanzees for 3.5 years. And what they found out after 3.5 years of use, the chimpanzees' villi got shortened. And the villi are finger-like projection inside your intestine, which absorbs your nutrition. And this is how you're going to get protein, carbohydrate, your nutrient, vitamins, all to your body, rest of the body, through those villi. So when your villi shrink, you're not absorbing, you're not supplying the rest of the body. So the main things will be supplied, but not every organ in the body will be supplied. So you're gonna compensate the absorption in greatest amount. So what I'm asking you, if you need to take it 1 to 2 weeks regularly and then stop it, because then you're not allowing your villi to be shortened. And you can also use it infrequently, like once a week, to people who has an issue with constipation. So with all those benefits, there's also this side effect. And if you're using it regularly, watch for it. This is Dr. Virender Sodhi.